because once we have the emergencies, we must provide for immediate action as quickly as possible. Any delay we expect or we experience in this area could determine whether the person gets better, whether the case gets worse, even if the person actually recovers. Is he recovering on a good note? These are the questions we should keep asking ourselves. And this is area where our services as healthcare professionals actually come in greatly. Now, we have some sources of medical emergency. I will look at this on the long run, one after the other. You can see one, we have bleeding. Bleeding, there are cuts and wounds causing bleeding. But severe injury can also cause internal bleeding. Most times we see surface bleeding and we focus on that, and it takes our attention away from bleeding that may be internal. So we do that. We look at breathing difficulties. We look at someone collapses. We look at fit or epileptic seizure. We look at severe pain, heart attack. If we have the time, we'll look at stroke also. So these are some of the medical emergencies. We'll look at how to manage them within the time we have at our disposal. What we're talking about here is that medical emergencies, I mean, the timely care for the injured, like I said earlier, will determine the chances of recovery and recovering better. Somebody could have a medical emergency on the road. I just assume somebody that is pregnant. Pregnant women, most times, you see some of them, they faint on the street. They have loss of oxygen. They faint on the street. I mean, what kind of help comes that woman's way determine the safety of herself and the unborn child. You have somebody who's epileptic collapsing on the street. Somebody runs short of oxygen, collapsing on the street. The bystander that first see the person, what that bystander does with that case determine what level of recovery that the person can get. Do we ignore the person and move on? Do we close our eyes as if we didn't see the person? Do we call 911? Once you are able to get across that person and able to get the person in the recovery position, the next thing you must do is call for help. When you call for help, there could be any person that has basic knowledge of emergency management. There could be a doctor around. There could be a nurse around. Or somebody is there that can even help you call for an ambulance. An ambulance comes, take the case to the hospital. So at what point the ambulance comes to your rescue is also very important. If you call for ambulance, does the ambulance come about 2 hours after? 2 hours after they come and pay that patient, is that still an emergency management? No, we have wasted so much time because the time we have for the patient to have good recovery, good outcomes, we have wasted it. Even when we get to the facility, the healthcare facility managers or personnel, do they see this case as an emergency? Do they see this case as a cold case, or see this case as a case that one of those such cases and nobody's even concerned? These are the things that matter in terms of emergency. How they manage these cases is what determines the level of recovery and the speed of recovery. So timely care for the injured is very important in emergency. We look at what you call the incidents and how prevalent are they. Now, if you look at HIV/AIDS, TB, and malaria combined, they are not as severe to what you have as issues that happens in trauma. So issue that happens in injury and all what have you, I mean, it's far more than these three diseases like HIV/AIDS, tuberculosis, and malaria combined. The prevalence of injury is higher than these ones, but yet we don't get enough budget, enough funds dedicated for trauma management, for injury management. This is the problem that we are having. So we need to see how we can advocate for government to allocate more funds for issues as injury management, trauma management, so that people can have enough, even facilities can have enough funds to manage these cases when they come. Most times we take cases to facilities and we are not getting the right result. Most times it's not that the facility people don't want to manage the case. They don't have the resources, mostly if it is even a government facility. So we need more budgetary allocation, for these purposes. Injury could lead to death, definitely. We don't know what kind of injury and where they are coming from. Now we look at what kind of injury are we looking at. Here we have injuries coming from war, injuries coming from road injury, coming from poisoning, coming from falls, and all what have you. But when you look at this, graph, you will find out that with this continuum, you find out that road injury account for about 28%, is the highest of it all. So 28%, and you can see falls account for 14%. You can see other unintentional injuries and suicide. So you can see all you have is that the road injury account for more, even falls and suicide. So if this is the case, we need to give more attention to injuries that come from these areas and manage them medically as much as we can. The question is, where are they coming from? One of such, we have those injuries, they come from the street. People walking on the street, vehicle could run into anybody, and the person could have sustained severe injury. People could start fighting on the street. You have attack on people on the street. You have accidental discharge. Many things could happen. Somebody running and fall. Somebody falling from height on the street. Somebody falling out of a moving vehicle. There are many injuries that come up from the street. Even in our homes, I mean, a child play rough play at all, running through the stairs and falls and breaks his head. These are where the injuries are coming from. So we need to know where they are coming from and know how to manage them. Schools, horse play among children. Children must be children. In school, they play, they get injured. Some could be very severe, some could be very minor, but these are all injuries. And we need to know where they are coming from. Sea, from lake, those that go to look for how to catch fun, even rivers, they get injured. Swimming pool, they get injured. These are the areas where injuries are coming from. And again, you also have a level of injuries coming from workplaces where we work. People could slip and fall and have dislocation. People could fall from their seat if their seat is bad. People could jam themselves, I mean, on the walkway, on the coming out from door into another room. So a lot of things happen within this space. These are the areas where the injuries are coming from. Road traffic injuries alone account for 1.35 million deaths per year. That's a global figure. Road traffic injuries alone account for 1.35 million deaths per year. Please keep that in mind. And fatality rate is low in countries. Fatality rate is in low income countries and nearly triple those in high income countries. So the fatality that we have in low income countries about 3 times outweigh what happens in the high income country. You can see right now the high income country is having 9.2%. I mean, in the whole year. You can see the middle income country having 18.4. Look at low income country where Nigeria falls into. We are having 24.1%. I mean, within 100 population. So these are within 100,000 population. These are the kind of things you look at. How do we improve our system? How do we look at what is happening right now and see how we can reduce this? So these are some of the things where the emergencies come from, and these are some areas where we also think we need advocacy, we need education, and we need government intervention. You can see here, road traffic injuries are the leading cause of death for those between age 5 to 29. So people between age 5 to 29, road traffic accidents seem to be the leading cause of death. And these are some things we should keep in mind so that we're able to see how we can support these people and help them manage their difficulties, or create advocacy that these people can follow and see how they can have what we call behavioral change. This is called the emergency care system framework. Okay. Now you have what you call the emergency care system. You can see where the bystander is. What that means is that where you pick the case from. Okay. Where you pick the case from and how you're able to get the case to the provider or through the dispatch, through ambulances. You can see it is all connected. This talks about the connectedness where everybody must man his bit. At the scene of the accident, you can see bystander response. You can see dispatch. I will dispatch from them. Then the provider response. So at any point that any person within this chain of support allowed ball to drop in his or her court, the patient suffers. So emergency response must start from at the point at which a bystander is able to pick the patient, the victim. An ambulance comes and pick the victim from them. How they take them to the hospital, what he also does with the victim. This all put together is what you call the emergency care system framework. What that means that everybody within the chain must perform their role properly and do what they have to do so that no ball drops in anybody's court. Okay. Now, something we're talking about here, the connectedness of our actions. You can see where the bystander picks the case. Simple action can save lives. I mean, even merely looking at taking cognizance that somebody that was standing close to you at the bus stop collapse, recognize that this must be a medical emergency. It will help a great deal. Being able to quickly come down with the person and support the person, put her in a recovery position, this helps a great deal. So most times, let's be observant where we are. Don't say, oh, I'm not a trained first aider, I can't help. That you are even able to call for help at all. You have performed a very important role in medical emergency management, because if that person that collapsed could have been able to call, but because you saw the person collapse, you were able to call for help. Somebody came and helped you. You have performed a very great role within that emergency chain of reaction. You have what we call pre-hospital scene and transportation, that where ambulance come, pick the person. How trained are the responders? The responders that are in the ambulance, because a clear example is somebody that fell from the height and have fracture of the backbone, or yes, fracture of the backbone or injury of the backbone. If you don't manage that person properly in a way that you carry the person well, you could end up complicating that person's situation. That person may become paralyzed because you didn't handle that person properly, because backbone actually is very sensitive, and that is what the person needs, to stand erect. But the way we manage that person, from the point we pick the person or put into the ambulance, and how we manage and handle that place where the fracture or injury happened, will determine whether the person will walk again in his lifetime or whether the person will become paralyzed. The thing is that as in emergency medical response, it is not your role to complicate somebody's already existing problems. Your role is to ensure that you provide adequate support, adequate provision to make the person feel better and recover, and help the person recover early. That's your role. Then when we also go to the hospital, systematic care for every injured person. In the emergency unit, does they also have what you call accident and emergency unit? Do they have intensive care? The nurse that we meet in the hospital that's going to respond to the person, is he trained? Does he see the case as an emergency? Does he know how to look at, how to see case and determine this case is severe? We need to see what we can do. These are things we look at for. So every action, they are all connected. They talk about rehabilitation. This maximizes the impact of emergency surgery. Sometimes somebody that have suffered maybe fracture, and they had to operate the leg or whatever, or even the leg was not operated, it got healed up over time, and now he's limping. But not because he's going to limp forever. You need further treatment as physiotherapy and all have you. Is he able to get it? Are we able to make it available to the person? Understand that all this chain of reactions, they are all what you call emergency medical support, and they help the person to recover and able to live normal life afterwards. But when we miss out in any of these fragmented circles, the person might really not be able to work or get better for the rest of his life. Now we're moving to the case of bleeding. Most times people can't stand blood. When we see blood, some of us, we escape. We can't even stand because blood looks like, oh, I can't stand this. I remember when I started working in the hospital, the first few days, I saw people being brought into the hospital with blood all over. I just couldn't stand it. The first time I saw somebody die, I just couldn't eat when I got home. But over time, they become part of you, what you see every day. Because the truth is that whether you like it or not, there will be blood on the floor. There will be blood as a result of injury, or even anything that happens in the hospital, blood will always come out. So you need to understand that you are seeing blood doesn't make that case more complicated. You have to look for what you can do. Understand the fact that when we allow somebody to lose more blood, the more somebody loses blood, the weaker the person becomes. So when we see somebody bleeding, the first thing we should do is see how we can support in seeing how we can stop the bleeding, help stop the bleeding. Bleeding is the release of blood from broken blood vessels, either inside or outside the body. Like I said earlier on, there can be internal bleeding. The one that we see that is coming out that our eyes can see, those are blood that are coming out from the external body. They are coming out for us to see. But we also keep in mind that there could also be some internal bleeding that our eyes cannot see. Let's not rule that out. That's why most times we always tell you, wherever this thing happens, you must seek the help of a physician as quickly as possible, a GP as quickly as possible, who is able to help you diagnose. Yes, I think with what I see, this person have internal bleeding. You can see some bleeding coming out, or sometimes even no blood. but the person is bleeding internally, you wouldn't even know. So that the person is not bleeding externally does not mean there is no possibility of the person bleeding internally. So as a medical emergency provider, you must recognize this, that there are two ways to bleed, either internally or externally. Not all incidents of bleeding need emergency medical treatment. Often, they can be treated by first aid at home, following advice from a... The truth is that if you are home and this happens, because most times, emergencies happen at the dead of the night. 2 a.m., you are alone with your child, and maybe the junior mistakenly fell. What are you going to do? You can't go to the hospital at 2 a.m. And now you are seeing blood coming out. What are you going to do? Have somebody you can talk to. Have a doctor you can talk to. Have a healthcare provider you can talk to. Like I can say, this will happen to me. This what they can actually run you through the telephone on what you can do to make the child stabilize and make the child sleep back again until you are able to. That what you are doing at that time is first medical emergency response for your first responder at that time. So that case, that response you are giving is able to stabilize that case to the point that money comes. You are able to take that child to see a doctor physically, but you must know what to do, and that's why it's important that these kits are available. And again, you must have number or access to a GP you can call. At such a dead time of the night to guide you through what you can do. Even if not GP, there are developed country, you have ambulance companies. What you can do, you call the ambulance line. This is what I'm going through. Ask you, okay, we can't come and pick the child this night because the destination where you are is far from us. But you can start doing this, and they take you through all this thing until you find out that you're able to do a lot for the child to get better until the next day. Okay. However, emergency treatment is needed if, one, you are unable to control the bleeding. Even after delivering first aid and the bleeding still continues. Don't waste time. If the bleeding still continues, emergency treatment is needed. Understand the fact that the human body has between 4.5 to 5 liters of blood. And the more the person loses blood, the weaker the person becomes. So if you have done all you have to do, the bleeding still continues, quickly see how you can rush that person to seek a medical emergency from a hospital or a provider, okay? If there is an object seen within the wound, or it appears to be deep, somebody that's, maybe somebody stabbed somebody with knife now, or whatever it is, and the knife comes out from the other side, or it leaves the knife inside the person's body. The truth is that when you take out that knife, you are going to see what you call gush of blood. Such scenario, you are not supposed to take out that knife or take out that material or object, leave it with that person and rush the person to the hospital like that with that object still inside his body, inside his hand. Because when you take that object out, the blood that will gush out, you don't have the capacity to manage it. So you need to be in an environment where there are experts that can help you to manage those things where they take it out. So when you see that, it's not your responsibility. Just see how you can mobilize that person and ensure that the person is taking the hospital as quickly as possible, where there are enough hands to manage to set it and stop the blood and get the person treated properly. Okay, because sometimes such cases need to be sutured, need to be bandaged for a long time. You don't have those things at home or wherever you are, responding to those medical emergencies. Okay, or a case where you can see tissue or bone. Maybe something happened, you are seeing the tissue of the tissue or bone inside the person's body. It's not a case you have to start seeing, let me see what I can do. That kind of case, as quickly as possible, move that person to a hospital where the person can have what you call emergency treatment, because at that point is beyond what you can manage from where you are or what you can manage from home. It's very important that you keep that in mind. Okay. Now we look at the issue of management. How do we manage bleeding? The person who is bleeding should try to remain calm to keep their heart rate and blood pressure controlled. Listen, either heart rate or blood pressure being too high will increase the speed of the blood. That's why reassurance is always very important in medical emergency. Reassure the person, even if you see the case that is severe, reassure the person you will be fine. You need to calm the person down, because once it calms down, the heart rate and the blood pressure is controlled. Just calm down. We are already at it. We have called an ambulance. Ambulance is coming. Just calm down. They'll be here very soon. So the person is not apprehensive. But the more the person is apprehensive, the heart rate and the blood pressure, they begin to spike. And the more they spike, the more the speed at which the blood in the body begins to come out. Remember, I told you earlier on that the total blood in the human body is between 4.5 to 5 liters of blood. I mean, if he's losing it continuously over time, he has lost so much blood. You find out that he's beginning to lose more blood there's beginning to be lesser blood than he needed to than he needs for his body to survive. The person now begins to get weak. So it's very important that you keep this in mind. Lay the person down as soon as possible to reduce the risk of as soon as possible to reduce lay the person down as soon as possible to reduce the risk of fainting, because the more the person stands, the blood is gushing out and the person is getting weaker and the person could faint. Or again, what you could do is lay the person down, elevate that area where the person is bleeding from. If it's a leg the person is bleeding from, elevate the leg, let it be above his heart level. That means the blood cannot transit up and it begins to go back and the blood flow begins to decrease. You let me share an example. You remember, you know that at some point, most of us who go to churches or even those that go to mosques, in churches, you find out that you are worshiping in church, your two hands are up, right? And you find out that you can't sustain those hands up for too long. Most of us have seen such scenario where your hands are up. Over time, the hands start paining you, you bring them down back. So you know what really happens? When you take those hands up, the blood flow into the tip of those fingers begin to reduce. Why? Because the blood cannot climb into those areas. They begin to reduce. That's why you see your hands are getting weak and you are beginning to take them down. So this is the formula we are applying here. When we elevate those legs, find out that the blood cannot travel like going upward a hill, upward an elevation, and the blood begin to come back and you reduce the bleeding that is coming out from the bleeding that the person is suffering from. Remove all loose debris and foreign particles from the wound if possible, but not when they are large objects that are buried into the person's wounds. Leave large items such as knives, like I mentioned before, such as knives, arrows, or weapons where they are. If they are buried in the person's body, don't pull it out, because the person will bleed to death and you cannot manage such things. What you're doing, you are to support the person to live, not to support the person to die. So understand that when those items are buried in the person's body, you need to take the person to the hospital immediately. Removing these objects can cause further harm and will likely increase the bleeding. Like I said, in this case, use bandages and pads to keep the object in the place and absorb the bleeding while you quickly take the person. Just 1 minute. I'll call you back. While you quickly take the person to the hospital is very important. In the case, you just bandage the place while you see how you can take the person to the hospital on the long run. Okay. Now we have issue of breathing difficulties. Most times we undermine breathing difficulties, but a lot happens within this area of breathing difficulties. When you have difficulties in breathing, whether at home or at work or at night, please, it is not safe for you to be alone. It is not safe to take it for granted. Seek help as quickly as you can, because this could result into a number of things. This could result into a number of things. And when you have a patient that tells you, I'm having chest congestion, I'm having difficulty in breathing, you need to give that patient immediate attention, as something terrible could happen.
Anyone?
Can you let me mute that person? A person who is having difficulty breathing feels short of breath. You start having what we call shortness of breath. What does breath do for? What breath does for you is that it helps you take oxygen in. It takes oxygen into your body, but by the time you are having shortage of oxygen coming to your body, you will definitely faint. You will definitely collapse. Okay. A person who is having difficulty breathing, feels short of breath, has trouble inhaling or exhaling, or feels as though they cannot get enough oxygen. Difficulty breathing can be mild or be severe. So when a person is not able to get in enough, you can't look at you can't you are trying to breathe, but nothing is coming in. You are trying to breathe out, nothing is going out. It means there's a problem. So you have difficulty. You are running short of oxygen, and when you run short of oxygen that gets to the brain, when it reduces, you are bound to collapse. You will faint. So understand the fact that this is very crucial. I must take this.
Dr. Ehwi, we have lost you. Good evening, sir.
Hello, good evening, sir. I can't hear you. We can't hear you again.
Please hold
Hello,
on.
Dr. Yahi, are you still there?
I think the
Dr.
lecturer
Amy, we
has
can't
lost
hear
connection. Let's
you.
just be patient a little. Yeah, I think he has lost connection. Just be patient a little, please. Sorry, he's trying to connect back. Just give him a few minutes, please.
Dr. Chus, good evening, sir. This is Engineer Tukulawa.
You are welcome, sir. Good evening, sir.
Many apologies. My connection went out. Okay. Can you hear me now?
Yes, sir.
Okay. Apologies. My connection went out.
Yes, we are with you, sir.
Okay. Where we were, we're talking about people have difficulty in breathing. Oxygen does not get to the brain, and they have fainting sensation. So we should always keep this in mind. And again, we have also people that have underlying health condition as asthma and other related conditions. Very often, people experience trouble breathing after exercising. That's why you see some people, they say, "Oh, the person has been keeping fit. The person just finished exercising and he collapsed." These are medical emergencies. I mean, having difficulty in breathing after exercising, and this is also some crucial area we should also keep an eye on and see how we can help. That's why most times when people or who take sports as a career, when they're exercising, there's always a medical team that stand by them, because anything could happen, and it could lead to something more disastrous. In some cases, breathing difficulty can signal a medical condition. So it is essential to work out what is the cause. Breathing difficulty could signal maybe a condition as heart attack. It could be anything. So it's always very important to work out the cause. Some of the causes of breathing difficulties could be somebody having cold. You are suffering from cold or catarrh or flu. You find out that your nostril part, the nasal part where you're supposed to use to breathe is narrowed, so you have difficulty in breathing. Somebody having anxiety, is having apprehension, having difficulty in breathing. That's why most times somebody tells you that I'm losing air. That's what it means, having difficulty in breathing. Okay. Asthma, that's why when we have somebody faint, or somebody suffering bereavement, or somebody have something that is so maybe bad news. The first thing we do is let everybody stay clear. Let air get where the person is. This is what we mean. People that have asthma, those are already having underlying respiratory issues. People that are choking, because when you are choking, I mean the airway where air could get in is difficult for you to breathe, and that blocks. Okay. Breathing difficulties after it. That's why we tell people, most people that like to take big of food or pounded yam or gari or yam, it's better you take smaller size, because most times you get choked by the food you are eating. So you are able to swallow big balls of pounded yam. Doesn't make you a strong person, or there's no award that is given to you by doing that, but you stand a chance of actually choking yourself with the food you are eating. Take your food in smaller quantities. I mean, take your balls in smaller quantities. Always in smaller balls is always better for you. You have people that have what you call chronic pulmonary disease, also COPD. I mean, that's where you have things like heart attack, they fall under. Okay, these are some of the breathing difficulty. Then, who is at risk of breathing difficulty? Risk factors could vary greatly depending on the cause of the breathing. A lot of things could cause it, and a lot of damage could also come from it. And a lot of people suffer it differently. You take a clear example for children. I mean, who are most at risk of choking than adults. When we talk about children, I mean, the children, even infants, they put more things into their mouths than adults do. So you find out that they have, when those things hang on their throat or their nose, difficulty in breathing become a problem. I mean, we had a case many years ago in Port Harcourt where a child, and that's why where a child that was sent to school, the mother plaited her hair, used beads to decorate the hair to make it look fanciful. Pulled out one of the beads from the hair and put inside her nose, and it was a big issue. I mean, we were battling with that thing for almost 4 hours to that, and she couldn't breathe. So this is something we have to work as a sick bay nurses or sick bay help. We need to understand that these are issues we must look out for, and should be available to also be able to deal with this issue. Then while smokers also have higher likelihood of developing emphysema, where they have difficulty in breathing, the place where there should be oxygen, carbon monoxide is taking over those parts of their body. These are critical issues that we also have. People with asthma are more at risk of having breathing trouble following exercise or exposure to allergens. That's why we say people with asthma, like someone that's asthmatic right now come into a place where they just painted, where the paint is still very sharp. It could create crisis or activate a crisis for that asthmatic patient. Don't take them to a place where there are dust infested place. They are allergic to such places. So when you get that place, they start wheezing. And they're not able to breathe anymore. They're looking for how to breathe, because that place, that the first thing we do in emergency care management, when we're able to get them, is to nebulize these victims. That's what we call nebulizers. Nebulizers help them to clear those parts of their respiratory area, lung area, so that they're able to breathe well again. Keep active and eating healthy food. Balanced diet can help prevent many issues. Most times we don't eat food that are healthy. Sometimes we eat yam in the morning, we eat eba in the afternoon, we eat pounded yam in the evening. We have done the same thing for the whole day. Eat food that are healthy. Don't allow yourself to eat. And again, eating is not about having you have a big bowl of food. Doesn't mean that you are eating healthily. Make your plate colorful. Eat more of carbs, more of fiber, more of veggies if you can, and then fruits. After that, don't go back to beer parlor and go and drink two bottles of Star mortuary standard before you come back home. That's not a lifestyle. You also have to see how you can keep yourself healthy. It's for your own well-being and it's for your own. That's why we see some people, they go outside, they drink, they come back, they eat to Kobe, they eat this, they come back to the house after drinking, they're sleeping, they're snoring, they can't breathe. You've actually putting pressure on your respiratory organs. It's very important that we understand this. Understand the triggers that lead to the risk of breathing difficulty. And one of the things you can do with that is stay away from the things that trigger breathing difficulties. It's very important. That's one of the quickest way to manage breathing difficulties. Then remove all the way to manage it. Remove all objects in the throat in case of choking. When you see either a child or an adult that is choking, see how you can remove the object from the throat, clear the throat, and let the child be able to breathe again. How do you clear the throat? You can see these pictures right now. These images that are here right now. The woman wearing red top is having a child. You can see what he's doing. If the same way, it's not the same way you do hemic maneuver for a child that you do hemic maneuver for an adult. What they are both doing is hemic maneuver. For a child, for an adult, you put your hand across the person's around the person's, a little within the umbilical cord area, and try to jack it up. One, jack it up again. Two, jack it up again. Then you hit the person's back. When you do this, the person is either forced to vomit, and what those things were that were blocking the person's that block the person's throat or choking the person may fall out. So that's how you handle choking in adults. It's called hemic maneuver. You hold the person's stomach, put your hand at the base stomach around the navel region, then you jack it as if you are pulling it up to the chest, and you do that 1, 2, 3, hit the person's back. Whatever is blocking that is causing that choking could fall out. But for children, you do that, you kill the child. What you do for a child, use one hand to hold the child on the stomach, let the stomach rest on your hand, let the child's head face the ground. You give the child a tap in the back a little, a tap in the back a little, a tap in the back a little, a tap in the back a little. Then whatever is blocking the child and lead to choking could fall out. So this is how you manage choking that lead to difficulty in breathing in both child and adult. Then again, there are medications for inhalers for asthma. For those that are asthmatic, your Ventolin is a popular inhaler that you can actually give to them to help them clear their respiratory condition. Then epinephrine injections also what you also give, and then antacid. But I'm not saying you should give this. These are things that is done by trained medical professionals who are trained to give this medication. Don't just go and start buying this medication and start giving to people. You are not trained or licensed to do that. Then after all that, it's important that you see a doctor. It is important that you see a doctor when this choking keep happening or this breathing difficulty keep happening. When you have survived it or when you have been able to manage it, go and see a doctor. Complain to a doctor what you're going through. Let a doctor do proper examination of you, then know what next to do. This is very important. Okay. There are many potential ways to prevent to prevent the development of breathing difficulties. Some steps to consider include, like I said earlier, taking smaller bites of food. Don't swallow too big lumps of pounded yam or too big lumps of fufu. It doesn't make you a tough person. Take your food in smaller, even if you are eating swallow, take them in smaller balls. It's better for you. Take them in smaller balls. If you are eating yam, chew as much as you know you can swallow. If you are eating rice, chew as little as you know you can swallow per time. The food is for you. You will finish it. And again, one thing you have to also understand is that the rice, the bowl of rice is before you. It doesn't mean you must finish it. What the Lord says, eat until you are no longer hungry, not until the food is finished. What is hunger? Hunger is body's physiological call for food. The body needs food to work. Then when you eat to the point that you find out that you are no longer hungry, leave the food alone. And that's why most of us, when you see some people, they eat, it looks like the food that you see them eat at once, it looks like they are contemplating suicide. No, eat little at a time. It helps you because the more you eat, the more your neck region expand. And the more your neck region expand and you have fat gathered around your neck region, the less you are able to breathe properly. That's why when you get apnea, you see people, they go to sleep at night, they snore all through the night. Why? Because the neck is becoming too big. So there's a compression within that area where you also used to breathe properly. So these are the things we're talking about. Avoid smoking and drinking in secondhand smoke. Avoid smoking and breathing in secondhand smoke. Most people that smoke, they are primary smokers. Those that are there to inhale the smoke. Your case is even worse because the fact that they're smoking, in that butt of the cigar that the person is using, there is a filter, but they are filtering in the smoke before it comes into them. But you that is inhaling them, there is no filtration, so you are inhaling them directly. So it also causes you breathing difficulties. So these are some of the triggers. Leave areas where people smoke. If you hang out with smokers, they are your friends, they smoke, you are around them all the time. You say, I don't smoke, you are the worst smokers amongst them. And over time, this could lead to breathing difficulties. Okay? Taking allergy medications and avoiding known allergies. I mean, that's another way to prevent it. When you know those things are allergic to, and taking those allergy medications to prevent them, that's also good for you. Just like when you know you have an asthma, you are always with an inhaler, or taking ventilator tablet. That's also very good for you. Then eating healthy meals and exercising regularly is also good for the body. Let's not just eat and from there we just go to bed, and that's what happens a lot most times these days. After eating, we sit down on the sofa, we watch television, we won't sleep off in that place. No, let's learn to exercise. It's healthy for the body. Okay, like I said earlier, on eat smaller meals at smaller portions and at smaller balls. Taking prescribed medication for chronic conditions and avoiding triggers that could trigger issues that lead to breathing difficulties. If there are questions, maybe I stop here to ask them, or if not, we can go ahead and put the questions together. When we are done, we can answer the questions at once. Okay, so should we go ahead or we take questions now? Should we go ahead?
Let's go ahead, sir.
I'll call you back. Okay, let's go ahead. All right. Now we are going to deal with the issue of sudden collapse. Okay. Sudden collapse is something that is so rampant these days. Somebody having what you call, you say, I saw the person yesterday. He said he just went to have his bath. He just collapsed. What happened? He was going to work. He just collapsed. What happened? Oh, I saw him. I saw him standing in this place. I went to just bring water for him. Before I came, he collapsed. What happened? Then how do we manage it? So these are things that happen. That happen every day. That we see happen every day. We must understand how to manage these cases when they happen, because it may happen in your home, may happen in your neighborhood. You should be able to help when such things happen. Okay. Sudden collapse is caused by fainting, which is a sudden loss of consciousness as a result of shortage of oxygen to the brain. Please underline that word, shortage of oxygen to the brain. So when somebody collapses, one thing you should have in mind is that there's a shortage of oxygen to the brain. That's why the person collapsed. Then the question you start asking, what led to the shortage of oxygen to the brain? That should be what we'll try to unravel. Okay. So when somebody collapses, the first thing you do is first take away all the. I mean, if he's wearing tie, help remove his tie so that air can come into his losing his tie, unbuttoning his shirt to a little. I mean, and the cuff of his shirt, unbuttoning so that air can come to him. Pull the person down and put him in a recovery position. Recovery position so that from that place we know what next to do. Some causes of sudden collapse may include, but not limited to, what you call poor circulation of blood. Okay. Then the use of certain medications. I mean, there's some medications you are on that will lead you that get you exhausted. You find out that it leads to sudden collapse. And again, some medications are so strong that you don't take them with empty stomach. You take that. I mean, most people have followed that habit where they're on some medicines and they go out. They said, "I'm rushing. Let me go take the medication." They take the medication on empty stomach. These are some of the causes of sudden collapse. And you collapse on the street before you know what's happening. Sometimes the medication you are on, they are too strong for you. That's why most times they ask you, "Have you taken this thing before?" If you know that once you're on the medication and you find that it's too strong for you, go back to where you were giving. Say that you can't stand the medication. I remember those days when I was writing jam, I was living with my aunt and I had malaria. There was this drug called Malareg that I bought in the pharmacy close to us. Then I used to live in Festac. This Malareg almost killed me. It worked for me, but the what I went through the hand of that Malareg, I thought I was good. That it destroyed all my body to start with, and we haven't survived that. I became okay, but you may not have that kind of strength or energy to go through all that. So once medication you are on is causing you issue as sudden collapse or fainting sensation, please discontinue and get back to the physician that prescribed those drugs. Then low volume of blood or blood pressure, or example, due to dehydration, low volume of blood pressure in the body, volume or pressure of blood can also lead to you fainting. I mean, that's why we tell people, do your hemoglobin, do your see what level do your hemoglobin, do your full blood count, let's do the level of blood that you have in your body. Most times people don't do these things. You do. I mean, sometime ago, my wife wakes up in the morning. I mean, she's managing her weight. Wakes up in the morning, takes a cup of water and lime. It's a regular thing for her. She was doing this for so many years, for so many months. So one day I came back from work, told me that she was walking and she felt that she was feeling dizzy, you know. So the reason that came to me, this woman must have crashed her sugar. And I told her to come to the office the next day. We check her sugar level. Behold, her sugar level has gone low. So when you're doing those things, you're doing, actually those that are on special diet, that have what their nutritionists have placed them on. Please, when you are doing this, also check your blood pressure, check your sugar level. Is very important because most of these things are able to crash those things, and so that you don't end up getting involved in what you call sudden loss of consciousness. The emotional distress also then issue of cardiac arrest. Fainting, cardiac arrest on its own may or may not give you. We're going to look at it as a subject later. May or may not give you sign, and it just happens, and everybody's running up and down. So it's important that you keep this in mind. Fainting is not usually serious, but sometimes it can indicate an underlying medical issues. Some of the faints, it may not be that the person fainted as the issue. What is the root cause of that faint? You may find that the person's sugar level has gone low. The person's blood pressure has gone low. My father is 98 years old. My father has never suffered high blood pressure. But as you age to that level, your blood pressure begins to go low. So now he suffers from what you call low blood pressure. Low blood pressure have about the same symptom as high blood pressure. So most times he say that he's feeling dizzy. We don't need to do anything. We just do. Either we give him salt sugar solution, or we just increase the salt intake, or we increase the salt intake, or we increase we give a bottle of Sprite, you know, just to ensure that he has sugar in his system and he has salt in his system. That pumps up again the blood pressure. That's why they tell you when you have blood pressure issue, tell you limit the quantity of salt that you eat, sodium. Limit your sodium intake. But when you have low blood pressure, increase your sodium intake. This is what happens, okay? Please keep that in mind. People should treat every case of fainting as a medical emergency until they have uncovered the cause and treated the symptoms. That's what we're talking about. You must know the cause. What is the cause of the fainting? What is causing the fainting? What are the underlying factors? Is it high blood pressure? What is going on? You need to understand what are the cause. Until you have uncovered the cause, you must treat it as medical emergency. So most times, some sudden collapse or loss of consciousness are driven or enabled by some underlying health conditions that you may want to finally get to know over time. What's the management for this kind of case? Help the person lie down on their back. Help the person that suddenly collapsed. Don't allow the person to stand. It doesn't have the strength. Let them to lie down their back or recovery position. Then unbutton his chair. Let air come into the person. Okay, put him in the recovery position. Then check for any injuries. Are there any injuries? Because most times when somebody collapses, it's not the collapse that is the issue. It's where the person collapsed on, where the person hits his body on. But somebody can collapse. The collapse is not the issue, but he hits his head on a very hard object, a very sharp object, and that becomes a secondary emergency, because it's not the collapse that's the issue right now, but the head he hits on a metal on the floor becomes more of an emergency. So you first check if there are injuries. When he fell, what did he fall on? When he collapsed, what did he collapse on? Are they hard objects, metal or sharp object where he may have sustained bodily harm from? And if there are, how severe are these bodily harms? These are the things you must look at. Managing medical emergencies from sudden collapse. Like I said earlier on, raise their legs above their heart to restore blood flow to the brain. What you do, like I said earlier on, raise their leg up, the blood flow begin to come back, lay them down, raise their leg up so that blood flow begin to come back to the brain, because when blood flow come back to the brain, they begin to regain consciousness again. Ensure there is plenty of fresh air. I mentioned that earlier on. Let people gather to watch this when they collapse. Drive this way. We allow fresh air to come to this person. He needs it more at this time of collapse. That's very important. If there is a crowd, ask other people to move away. It's important. Just ensure that the crowd leaves so that the person can have enough fresh air to come into his or her body and get recovered. When the person regains consciousness, do not let them get up too quickly. Most time when we have issue of sudden collapse and they regain consciousness, they feel embarrassed. They feel they have to leave here quickly. They feel ashamed. Don't let the person stand up. At that time, he or she still doesn't know what he's doing. Allow the person to sit down a little and ensure that he recover properly. If possible, look for a vehicle to take the person out of that place and let the person seek medical help to see what was the reason, what that really led to the collapse. Let doctors or physicians take it from there and see what best they can do for the person. Okay. If they remain unconscious for more than 1 minute, put them in a recovery position and get emergency help. If the unconsciousness remains for more than 1 minute, put them in a recovery position and call for help. At that recovery position, tell somebody, please call for help. Call for help means call an ambulance. Call an ambulance. Call emergency number. It's very important to have that in mind. Call for help. It may not be you are putting the person in a recovery position and watching the person. Tell person around that place, call for help. Please call for help. Call an ambulance. It's very important that you do that so that you can get you can see what I talked about earlier on. When we lay the person down, the person faces up, and see when we raise the legs up, blood circulation flows back to the brain so that the person is able to recover properly. And this is what I was describing earlier on when I mentioned this. Okay. Now we have issue. We are moving to fits and seizure. Like I told you, that those items, as I highlighted earlier on, we're going to take them one after the other. These are also medical emergencies that we need to also know how to manage. Most times there are a lot of cultural biases that surround fits and seizure. When somebody have fits or seizure, never you put a spoon in the person's mouth. It is not a scientific or empirically proven process. Yes, you will only worsen the person's condition. At the end of the day, the person recovers, has blisters all over his tongue, and you can also collapse that tongue, and the tongue falls into his mouth and block his airways. He's not able to breathe anymore. You are the one that aided the person to die when your role should be to aid the person to survive. Seizure is a sudden, underline that word again, a sudden, uncontrolled burst of electrical activity in the brain. It can cause changes in behavior, movement, feelings, and level of consciousness. That's why when it happens, you see them, it can change movement that below they collapse immediately and they start busting, fitting, they start vibrating. Don't try to stop, don't try to hold them to stop the vibration. Let those vibrations, let those fits, let them run their natural course. They don't run for too long, but allow them to run natural course, but ensure that that person that had fit and seizure, that is already having an episode, that there are no sharp objects close to that person. There are no things within that environment that could cause the person bodily harm. This is the best you can do to manage this seizure. Is that understood? So don't try to see, let me hold the person. You might, because as the person is fitting, all the bones are it's like that's why it's called, it's a electrical activity. All the bones are all the body is fit together. You could fracture that person's bone. You could dislocate that person's hand because you're trying to put the body together. No, allow that period, that episode to run its course and be there. Ensure that there are no sharp objects, no material that will cause bodily harm until they recover fully. Having 2 or more seizures at least 24 hours apart that don't have a known cause is considered to be an epilepsy. When you have 2 seizures, so fits is not the same thing, or seizure is not the same thing as epilepsy. Having 1 or 2 seizures at least 24 hours apart that have no known cause, then you cannot consider this as an epilepsy. Okay? Fit and seizure can occur in people who have diagnosis of epilepsy, but can also occur in people who don't have such diagnosis. Anything that cause, so there's some people that cannot stand a place where there is shortage of oxygen, a place that is too hot. I had a friend that came from Cameroon some time ago. He was telling me this story by himself. He said his friend was schooling here in Nigeria in Ibadan, and he came to see his friend. They have heard of Balogun Market before. He said, let them come to Balogun Market to come and buy things. He was very excited coming to Lagos. So they went to Balogun Market to see what they can buy. The moment they got to Balogun Market, he said he has never seen such a market before his entire life. He said the market was so congested. They were looking for things to buy. He said at a point, if the market had no oxygen, that means there was not enough air in the atmosphere. He said the next thing he saw, he collapsed. He ran out of oxygen. He collapsed. He said the next thing he saw that he was by near one somebody's shop. Water poured all over his body. He said, what happened? He said, you collapsed. He said since that day, I told himself, if he comes to Lagos again, Balogun Market is not meant for him. Because which of course you understand the fact that market is congested. So you find out that congestion can also cause such issues. I mean, people that are prone to this, they start manifesting, having episode because there is shortage of oxygen. Oxygen is very important in this dimension. A fit or seizure can involve the involuntary and uncontrollable jerking, twitching and shaking of the body of all part of the body. That's why I said earlier on, when they start jerking and having this twitching or shaking of the body, leave them. Don't bother them. Don't hold them. Let them run their course. Let this episode run on its own, so that at the end of the day, when they recover, you take them away to see a medical practitioner. It's very important. Another form of fit or seizure, and again, let me digress here. And again, people that have had, maybe you've had a situation, you had an accident where you hit your head somewhere, you had pressure where your head was hit somewhere, or you had things that happened where there was a forceful collision or forceful object that hit your head, and over time you find that it may have left some damage in your brain without you knowing, and this could also lead to seizure over time. I mean, it happens from people that have been involved in accidents, and even those that get involved in very dangerous sports, like people that play rugby and people that play this kickboxing. They are the ones that actually get involved. Even basketballers, they also have those head injuries. I mean, through collision. Okay. Another form of fit or seizure can involve no movement or minimum movement of the body. A person can appear to be looking into a place and it's not shaking, nothing but a seizure. In this situation, a person will tend not to be responsive, but this also is another form of seizure, though this is not always common. But the other one, where people jerk and twitch, is the most common, is the commonest form of seizure. It's important to remember not to move someone or try to stop them shaking if they're having a fit or seizure, unless they are at risk of danger. That's what I just told you earlier on. Allow them to do all those shaking, all those jerking, except they are in danger of what could injure them before you can interrupt those things and take them out of those places where you feel they could be injured. Right, like I told you earlier on, allow them to run their course. Just put them in the recovery position afterwards. Let them run the episode to an end, and they will be fine over time. Okay, there are many types of seizures, and they have a range of symptoms and severity. So seizure manifests in different types and different types of seizure that people have. And again, the severity of the seizure depends on how the person is manifesting it. So you never can say, okay, oh, this is what it is in Mr. A, what it means in Mr. B. It depends on how it happens, the gravity and the manifestation or severity. Seizure types vary by where they begin in the brain and how far they spread. You know, when I will look at something after now so that you understand when seizure really happens. Most time is the brain that seizure activates from, not other part of the body. The brain is like that's the central nervous system. That's the brain boss of a human being. Everything that happens to a human being, they all get activated in the brain. That's why we tell people protect your head. That's why it's difficult to see me ride on Okada. I find myself on Okada because that's the most dangerous place you can ever be, where you can fall and have injury to your brain. Most time Okada they don't even have helmets. You know, people do ride bicycle, they don't have helmets. You know, those things were designed to protect your head from any form of injury. Most seizures last from 30 seconds to 2 minutes. A seizure that lasts longer than 5 minutes is a medical emergency and must be treated as such. So you understand that seizure really, they don't last for too long, from 30 seconds to about 2 minutes. And when a seizure lasts to about 5 minutes, it should be regarded as medical emergency. When you have something like having seizure, let the person just allow the person to run his course, also observe the person and shield the person away from things that could harm the person or cause the person bodily harm. Then from there, we move to the issue of pain. I mean, we all go through pain on a daily basis, and a bodily pain. A lot of factors are responsible for pain that we go through, and pain is also considered as medical emergency. How do we respond to pain? According to the American Academy of Urgent Care Medicine and the American College of Medicine Physicians, a sudden or severe pain on any chest pain that lasts for more than 2 minutes or goes away and comes back requires emergency medical attention. So most times, understand the fact that any pain that lasts for too long or that severe that lasts for too long or goes and comes again requires emergency medical attention. Not say somebody telling you that I have pain in my chest and it lasting for too long. That pain, as a matter of fact, when somebody tells you I'm having pain, my chest is congesting, don't wait, because those are clear signs of cardiac arrest. That's where it starts. My chest is congesting, I can't breathe. These are things that these are statements that should get you worried. And it's important that you take action as quickly as possible when such things happen. Okay. Some of the sources of pain are headache, toothache, sore throat, stomach ache or cramps, muscle cramps or strains, cuts, burns, bruises, or bone fractures. These are all sources of pain. Then you have two types of pain. You have what you call acute pain and the chronic pain. Acute pain is a signal of discomfort in the body. It doesn't last for too long. I mean, lasts for a few minutes or a few seconds or minutes or hours, it disappears. But when you talk about chronic pain, this lasts for so long. It can start in the morning and up to this time it's still there. You should be worried. These are the kind of pain that you don't need to wait and say, let me observe it. No, get medical help as quickly as possible. So when it's an acute pain, it comes and it disappears too quickly. Yeah, those are no issues. Sometimes you try to enter your room, you hit your hand on the door, there's pain in your hand. And that pain, you find out that in the next 30 seconds to 1 minute, that pain disappears. That's acute pain. It comes for only a short term, but the one that's chronic pain that stays for too long, please consider it as a medical emergency and seek medical help as quickly as possible. Acute pain develops for a short period of time. It tends to occur suddenly after a result of no injury, illness, medical procedure. So it doesn't stay for too long. For example, acute pain may result from injuries such as cuts, burns, muscle strains, or bone fracture, illness such as food poisoning, and medical procedure such as injection. You take injection right now, that pain you get, or they want to take blood from you. That pain you get when they pierce your body with needles and needles trying to get blood for you. Those are acute pain. Find out that not in a few minutes or few seconds it disappears. You don't feel it again. Those are acute pain. They don't stay for too long. Acute pain tends to be sharp rather than dull. It could be a very sharp. It pierces and over time it dies off immediately. Usually it goes away within few days, weeks, or even minutes or months after the cause has been treated or resolved. But when there are acute pains, you must look out for what are the causes. What is causing this acute pain? And once you identify the root cause and you deal with it, you medicate it, over time it dies or it doesn't stay for too long. But chronic pain is never like that. It lasts longer than acute pain. Almost everyone, I mean, in our lifetime, we may have experienced pain, once in our lifetime. Then we have what we call chronic pain. Chronic pains last or comes and goes over multiple months and years. When somebody has this kind of pain or have this kind of pain in the chest, please do not hesitate to seek medical help. It may result from a variety of health conditions such as arthritis. Yes, people that have arthritis, these are conditions that they happen within your leg. Arthritis, migraine, or cancer. These are acute pain, but they are underlying causes that must be investigated and at the country. These are what you call comorbidity. You have arthritis. Pain is a comorbidity to arthritis. Arthritis leads to pain. So the pain and arthritis put together is called comorbidity. Some people also experience chronic pain following an injury, even after initial injury has healed. Yeah, the initial injury, sometimes you have a fracture or you hit your leg somewhere or you have a cut. Yeah, that injury may get healed, but the pain still remains. It's important that you look out for what is causing the pain, really, because it could be some nerves within the body. Some people, even they don't experience pain, they experience shock when you touch that area. Look at what are really the problems and look at how to medically manage it so that it doesn't come out to become issues that are more critical in the future. In some cases, the cause of chronic pain is hard to identify, which of course is true. Excuse me. Some people experience chronic pain when there is no other evidence of underlying injury or illness. This is known as functional pain, which of course it happens every day. There's no underlying evidence of underlying injury or illness, but the pain is just there. They are regarded as functional pain. Understand also that pain within the heart area or the chest area will also lead to what you call heart attack. This is what we're going to be looking at right now. We look at heart attack shortly. What is heart attack really, and what are the causes? A heart attack occurs when an artery that sends blood and oxygen to the heart is blocked. When an artery, it's like a pipe. When you have your water, the only way you can describe it is that your overhead tank is full, or your water is coming out with very, 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 very low volume. That's the best way I can describe it. Now you can see this diagram I have here. You can see the heart. These three poles or pipes or arteries, these are the arteries. The one that is very clear, that's where the arteries is still working and functioning optimally. When it's still very clear. Over time, our arteries get opaque. You can see the middle one. The artery is getting opaque. This one, the artery is getting opaque. You can see yellow stuff gathering around the artery. These are the things we talk about. We talk about stop. Be careful of food that has cholesterol or fats. Oily food. These are where they come to gather. They are gathering around these arteries right now, and this stops enough blood to circulate or oxygen to get to where or to get to the heart. And this is where the problem is. And now you find out that it migrates to this one. You can see right now, even this one is as good as blood. So blood and oxygen do not get to the heart not get to the heart at all. And this leads to heart attack. Even here, when you have this one that is here right now, they don't get to the heart in the volume and in the speed at which they need to get to the heart. That's why it's having those chest congestion. I just have a sharp pain in my heart. This was causing it. But when it becomes so bad that they can't really get to the heart at all, like we have in this blocked one, this is what causes heart attack. That's why we tell you fatty cholesterol-containing deposits build up over time, forming plaques in the heart arteries. These yellow things you are seeing. These are the cholesterol and fatty deposits. So when you're eating food that are heavy in fat, understand that you are clogging these arteries and where the blood and oxygen should be passing through to get to the heart. If a plaque ruptures, a blood clot can form. The clot can block arteries, causing heart attack. And this is what we're talking about. This plaque can rupture. This plague that you put, it can rupture. And when that happens, a blood clot forms, and that blood clot can block the arteries, causing heart attack. And that's why people say I had heart attack or cardiovascular accident. What are the symptoms of heart attack? Some people have mild symptoms, while some may not even have symptoms at all. Sometimes the first symptom signs of heart attack is sudden cardiac arrest. You have a sudden cardiac arrest and you recover from it. Once that happens, once you have a sudden pain in the heart or sudden chest congestion, or it looks like it blocks and it releases you, you need to be very careful. Seek a doctor's intervention urgently. Again, you might not even have that at all. The next thing you see is that the person was not even sick. He has not had heart issue. You had a sudden cardiac arrest. It means those arteries were blocked, and there was no way for oxygen or blood to flow to the heart. And the next thing you see is a sudden cardiac arrest. I was discussing. I had a meeting with a woman last week. On Thursday during the holiday. She lost her husband sometime in. Can you mute that person? Can you mute your mic?
Good evening, sir.
Please mute your mic. Admin, can you mute that person's mic? Okay. So she was telling me she lost her husband sometime August last year, and this man has never had any. But he just told me that I'm having pain in the heart. I'm having pain in the heart, and like joke, came back from work. I mean, with the driver, sat, ate his food. The next thing is it just I'm having pain. Fell from the seat. The next thing before the man could call doctor, get everything together, wear the man his clothes, and call a driver to come bring the regular rush to the hospital. The man died. Sudden heart attack. So we have to understand. That's why we recommend people that people should have things like aspirin at home, because aspirin helps you to is one of the quick pieces you can get as quickly as possible. So always have aspirin at home for those to manage such issues when they happen. Chest pain common heart attack symptoms include chest pain that may feel like pressure, tightness, pain, squeezing, or aching. And these are form of symptoms you have in heart attack. Pain or discomfort that spreads to the shoulder, arm area, back, neck, jaw, teeth, or sometimes upper belly. These are symptoms. Then somebody having cold sweat all over, fatigue, heartburn or indigestion, lightheadedness and sudden dizziness, nausea, shortness of breath. You should start getting worried and looking at what you can do. I mean, in case this person might be having earlier symptoms of heart attack, it's important that you give this attention. Then once this happens, understand the fact that one of the quick things you must do is that you must dial an emergency number as quickly as you cannot manage heart attack as much as you would have wanted to. It's within the confine of a trained healthcare professional. What you do at that time, quickly dial the emergency number. We don't use this is a global emergency number, but in Nigeria we use 737 or 112, 767 or 112. Use those numbers in Lagos. Dial those numbers quickly so that even if you see what you're doing, able to give aspirin and the person, you're able to do cardiac, you're able to do CPRO or the person, at least ambulance is coming your way. You must learn to do that. That's why it's important. Have emergency number available at your fingertip is very important. Haven't called 911. Give aspirin if recommended. Aspirin helps prevent blood clotting. Taking aspirin during heart attack may reduce heart damage. Do not give an aspirin unless a healthcare professional tells you to do so. For a known history of of cardiac arrest, you must have aspirin at home. I mean, I've at least watched a video where this man jogs for the better part that I had known himself. He went to jog this morning, came back into the house. The next thing he had cardiac arrest. The thing he could do was he was able to pick a phone where he was having that tightness of chest. Called his wife at work. The wife said, "Please, what you can do is quickly take an aspirin. Aspirin is on the drawer in the system. Take an aspirin." That was what happened. While he was doing that, the wife called 911. That was what saved the man from having full cardiac arrest and dying from it. So it's important that you have that in mind. Start CPR if the person doesn't have a pulse or isn't breathing. Once someone have cardiac arrest, you check his pulse, there's no pulse, where he's not breathing, you start CPR immediately. If you are untrained in CPR, do hands only CPR. Just do chest compression. Don't give rescue breath. That means push hard. Just push hard the chest on the person. Push hard and fast on the person's chest. Compress the chest. Keep pushing. All you are squeezing the heart to see if there could be urgent blood circulation for the heart to come to life. Do this about 100 to do this about 100 to 120 times in a minute. It will be fast enough for you to do that while help is coming your way. If you are trained in CPR, what you mean cardiac pulmonary resuscitation, and confident in your ability, start with 30 chest compressions before giving 2 rescue breaths. This is what CPR processes or guidelines recommend. Use an automated external defibrillator. I mean, if you know AEDs, what AED does is that it helps you to send shock to the heart of the person to create heart rhythm. So if you have an AED at home or your workplace or wherever you are, I mean, use your AED immediately, transfer shock to the person. That is, if the person is not responding, it could send shock to the person and reset the heart rhythm. That would be good enough if you have it. How many of us know Ericsson, the footballer that plays for, I think he plays for Man U now? Am I right? So Ericsson was playing football and collapsed. Ericsson died in a few minutes. But I tell you, what saved Ericsson, why Ericsson is alive today, was AED was available to transfer shock to Ericsson, and that was how he was able to come alive. AED comes with step-by-step voice prompt. But what we tell you that you cannot use AED if you are not trained in the use of AED, because AED can help, AED can also kill. So we recommend that anybody that can use AED must be trained in the use of AED. And this is how AED, you can see what this man is doing. And this is the AED. These are all the AED pad that be transferred to the person's heart and put this in on. So the machine is giving, these are from automated one, is giving prompting and transferring shock to the person to see how the person's rhythm of the heart can be reset for the person to come alive. So when you are transferring shock to the person, don't take your hands off, because the shock will even shock you and could harm you. So the shock is not for you because you are breathing. The person that is not breathing is the one that shock is for. So you don't touch the person while the shock is being transferred, and you get also injured or harmed. Then you must also understand the fact that we need to also look at ambulance response. We need to have partnership with these people to see when we can call them when the need arises, and they come and help us pick up patients. Know the ambulance numbers to call, and when they come, when you call them, when you are calling an ambulance, when you have an emergency, please understand that you have to be calm and calculated. We have seen people call an ambulance before in the time of emergency, and they mistakenly gave the ambulance their office number instead of their office address instead of their house address. Be calm as much as possible, because the person at the other end wants to be able to hear you and what you are saying, and it's going to reconfirm your address. Please confirm this is the address. Please be sure. Know that you are at home and give the home address. You are in the office, give the office address. Know where you are at any point in time, so you don't mislead them. And instead of coming to rescue you in your house, you first drive to your office before they find out that that's not where the emergency is. It's very important that you keep this in mind, okay? The draw up ambulance partnership is very important. And once that are done, ensure that you have this partnership in place if you do not have an ambulance in your system. And once this partnership is in place, also ensure the complement response crew are adequately trained and retrained. Responders are trained and retrained every 2 years. Every certificate that is issued to an EMS responder expires every 2 years. Ensure you look at the certifications or their credentialing are up to date. It's important that you have this in mind. Do routine preparedness audit of these ambulances. Look at the medications that are available in these ambulances. Look at the required equipment. Are they there? If the medications are there, are they still within their shelf life? Are they expired? I've done an audit of an ambulance before, and I found out that some medications are expired. When at the time of need, those medications won't they mistakenly give to somebody. So check if the required medications are there. If they are there, are they still within their shelf life? If they are not there, why are they not there? You need to be able to do all this. The equipment that they need, are they? I mean, I went to a certain school. Went to do inter-house sport upper week in Lagos, and they got across to us to help them go and audit these ambulances that they have paid for. And we went to one of the ambulances. They got us the address. They went to one of the ambulances, and they didn't tell, because they won't tell you. At the end of the day, they bring empty vehicle to you, and in time of need, there's nothing in the vehicle. It's just a vehicle that has one old rickety stretcher. There's nothing more. We went to the first ambulance address they were giving to us. We look at the ambulance. Honestly, that should be called an ambulance. There was nothing inside, not even an oxygen, not even a drip stand, nothing. One old miserable looking stretcher was what we saw inside. It was like a bed. We had to write it up. We checked the other ambulance, the second ambulance that they were giving. Yes, that was the standard ambulance. So it's important that you are able to audit your ambulance, and again, check the functionality. If there's spare tire, know that the ambulance, and you say, come and carry somebody that has an emergency, and before it gets to this thing, maybe on top of Thornbayland Bridge, he has a flat tire and he has no spare tire to change that tire. That's not an ambulance. That will help you kill that patient, because the time you have saved, the ambulance will waste all the time. And the patient could die. Okay, carry out response drills. What you can do with response drill, just do as if you have an emergency. Call the ambulance that you have an emergency at home. Look at how many times it takes for them to come to your place. So that's to check the level of preparedness and the response drill that you have. For ambulance to come from where it is and to come to your place. It tells you how many hours or minutes you need to wait for ambulance to get to you. Ensure you have more than one partnership and should have proximity to your facility. You can have more than 1, 2, 3 partnership, because you might call one and say that all the ambulances are busy, or they have been called out for some other emergency. What do? Look at option B, option C, option D that you can call up, to respond to an emergency. Okay? Investigate issues when they happen and use them to institute corrective actions. Assuming somebody they came to carry somebody and you didn't like what happened, you were not too comfortable, you went to do the inspection or the audit, you didn't find what you were looking for. There's no need to have issues about that. Use that as a learning curve. Let's use that to initiate corrective actions and ensure that the system is working properly. While we conclude, remember, everything about medical emergency response is time bound. Respond timely. You that's the person, respond timely. The ambulance is coming in, respond timely. So don't waste time. Anytime, a minute or second that you wait, somebody's life is at stake. So on this note, I say thank you for listening. If there are questions, I would like to take them now. Thanks a lot.
Thank you. A wonderful session.
Thank you so much. So I will wait for questions, if any.
Hello, good evening, sir.
Good evening, madam.
Please, sir, can you throw more light on resuscitation?
On what kind of case?
A collapse. Maybe the person collapsed and you want to try to resuscitate the patient.
Okay, I said
throw more light on that.
I said the first thing we do is to look at what is the sudden collapse. Like I said before, that oxygen there may be loss of oxygen to the brain. That's why the person may collapse, because the brain is not having enough oxygen to function. Then when this happens, the first thing you do is either you sit the person up and lift the legs, see the person, lie the person down, let it face up, and you lift the legs up so that blood can flow back to the brain. Do you understand? Blood can flow, because when your legs are lifted above your heart level, it's like a declined position that takes blood back to the brain. So blood is able to go back to the brain, and for the person to be able to come back to that. Then if the person is unconscious within that position for more than 1 minute or 2, put the person in the recovery position, then call for an ambulance. Call for emergency support through an ambulance. Then while the ambulance is coming, you have an idea of how to do CPRO, cardiopulmonary resuscitation, do 30 chest compression and 2 rescue breaths. You have to be on that continuously until the person is able to come back to life or the ambulance is able to come to your aid. But the truth is that you have, once you start to rescue your chest compression, we call the CPR, you don't stop, because this is how it works. Once you start CPR, you cannot stop until help comes your way. Why? Because someone that is passing that knows how to do CPR, I've seen you that you have started CPR, it is assumed that there's already a trained person that is already trying to help that person out, that the person walk past. So you can't do CPR halfway and say, it's like I'm tired, I have to leave. The doctor that did CPR for Michael Jackson did that CPR for over 4 hours. Do you understand? Did that CPR for over 4 hours. So we will see whether it will come back to that. So you have to be there until you have help comes your way. Somebody comes to take over from you, or an ambulance comes to pick that person. So this is the process. Is that okay, madam?
Yes, thank you very much, sir.
Pleasure.
Good evening.
Good evening, Mr. Godwin.
Thank you. Fine presentation. I really enjoyed it. I just want you to clarify more on the area you talk about shortness of breath. I'm trying to understand more on medication, the effect of medication.
Like you heard me mention, as a responder, we don't recommend you to take medication, because that's not your role. You see, at one part they said that if recommended by a doctor. So we don't actually tell you guys to give medication. So your role is to be a first responder to such people. But to give medication is not really your role, because we are not trained or licensed to do that. Okay. Yes. Talk. Lawal, talk.
What I'm trying to clarify.
Good evening, sir.
No, hold on.
This is Emir of Safety.
Yeah.
Can I go ahead?
Emir of Safety. Hold on 1 minute. Godwin, go on. Godwin, clarify yourself.
Yeah, the area you talk about shortness of breath and maybe some of the causes, like you talk about those who are close to smokers. I think there was a place you mentioned about medication. I don't know how that affects causes that, or I didn't get that clear.
Okay, I got you. No. It's not. I don't. I said those that are on certain medications. On certain medications, because like I talked about earlier, I said that some medications you are on could be too strong for you, and that's why I made the example I told you when I was taking Malarex years ago. So you have some medications you are on and they are too strong for you. Some people take medications and they don't take it with food, and this has a way of actually causing you a lot of issues. That it's not even the shortage of breath, it was the issues of sudden collapse that I mentioned. This you could walk and you have a blackout and you collapse because you don't have food in your system, or the medication you are on is too strong for you. Do you understand? And could cause you to have sudden collapse. I met a man last week, as a matter of fact. Let me just use as an example. He's not even on medication. He's on diet. He's large, but his nutritionist in South Africa placed him on a certain kind of diet. When I was with this man last week, upper week, I've never seen that man. He was shaking, literally shaking. So now I asked him, "What's wrong with you?" He said, I just started the diet that my nutritionist put me on. My body is not used to it." Because so those kind of issues, that kind of person, if care is not taken, could collapse. It doesn't mean that he has issues, but his body is what he's being placed on. His body is not adjusted to it. It's heavy for him, and that's why he could collapse. Does that help you out, Godwin?
Yes, it's clear to me now. Thank you.
Thank you so much. Okay, Emma, your hand was up.
My Oga, I'm happy when we reconnected again. I was full of expectation. I'm sure I'm getting what I wanted. So I also could just recommend 1, 2, 3 basic emergency safety kits that we should have in our homes. What will you recommend, sir?
Okay, thank you so much. That's difficult. Okay, firstly, it all depends, and again, it depends on the age of people you have at home, and if they are any under. If you have people that are at home, it means definitely you must have inhalers at home. Then again, if you are a trained person, you must also have nebulizers at home. Then you must have a first aid box, and in that first aid box, there must be kits that can, because most times injuries happen at home. There must be kits like bandages. There must be kits like alcohol prep they can use to dress minor wounds as they happen. You know, you must have bandages. That means if the blood, I mean, if the bleeding, I mean, is still out, and you want to see how you are able to dress it up before you get to the hospital, you are able to do all that. Then you are able to, for me, even I won't believe, along the line, also see how you can have issue of even okay, for those who may fall like deep heat, they are also very good for you at all. For those that have children that are very rested and involved in hospital. Then also have bandages that should the child fall, and you can actually use the quick bandage to tie around his neck, where you can suspend his hand in case there's a dislocation until he's able to get to the hospital. These are some of the things you can do on your own at home until you are able to get to the hospital. Oral medications is not recommended because most times the doctor will ask you at the end of the day, why did you give oral medication? And oral medication that you give as a non-professional, it could also complicate the person's condition, because again, there are medications you don't give to people, you don't give with some underlying health conditions, and when you give those medications and you complicate such issues. So this is why we don't recommend that you give medications when you are trying to help. Remember your role. You are only giving medical emergency response. I mean, to help the person until a superior help comes to the person's way. Does that help, sir?
Good evening, sir.
Good evening. How are you?
I'm fine, sir. I'm sorry, sir. I have another question.
I mean,
Okay, please, sir. Is this a seizure different from epilepsy? Because I read something about epilepsy, that epilepsy is a result of eclampsia. I want to understand something
no.
there.
Eclampsia is hypertension in pregnancy, isn't it? It's not. The truth is that what I presented, when somebody have 2 episodes of seizure within 24 hours back to back, that's because somebody can be diagnosed of seizure of epilepsy, but it's not the same thing as seizure. I give you a clear example. A biker that rides a power bike that had an accident and hit his head on the tar or hit his head on the pavement of the road. He never had a seizure before, but now he has seizure. It's not epileptic. Do you understand? But they seem to be close, but it's not the same thing. Let me even explain. You know, when you talk about seizure, what really leads to seizure fits or epileptic condition is when oxygen that need to get to the brain, because the brain needs oxygen to be able to function properly. Okay, it's like a pipe, right? It's like a pipe where water passes through. The water passes through that pipe with pressure. And now as the water is passing through that pipe, part of the pipe clogs. I mean, let's assume the pipe is 3 mm or 1.6 mm, that's all the pipe is. But as the water is passing through, in between, some part is compressed. So the blood is not able to flow to that place with ease or enough to get to where it's going to. So it contrasts like this, it contrasts and opens. So that part, when you see somebody have seizure, is that part where the oxygen is not able to flow or blood is not able to flow through that part, and that part contrasts. So the oxygen is not enough to get to the brain. That's when you have seizure happens. And that's why you see most times it doesn't last for too long. And when it releases again, the person may have done all the checking on the floor, and it releases again. I mean, have enough oxygen to get to where it's going to, and the person is back to normal. So this is a condition, actually. It's a condition. So seizure fits, seizure fits and epileptic condition, they are very close. So some people use them interchangeably, but they are really not the same. Seizure and fit, yes, but epileptic condition is more of an advanced medical condition. It's diagnosable. Is that okay?
Yes, sir.
Okay. Zeno, you're here. Your hand is up.
Yes, sir. Good evening, sir. Thank
Good
you
evening.
very
How
much,
are
sir,
you?
for the class. Mine is not
My pleasure.
actually I'm fine, thank you very much, sir. Mine is not actually a question. It's about what Mr. Godwin asked
Okay.
about how medications affect breathing. So I stand to be corrected anyway, but for my own knowledge and information I've gathered, basically I believe that the medicines we consume, they are not totally broken down when we take them. So they have residuals that actually rest in some part of our body, of our digestive systems, or the intestinal wall, basically. So over time, when these residuals, they tend to pile up, they tend to become problems to either our respiratory organs, our circulatory organs, or any organ, basically. So that's why most time it's advisable that you do not take drugs irregularly or excessively. When your body needs rest, don't take paracetamol and those aspirins. Just take a nap, eat very well, eat fruit, and just sleep. So basically, I believe that that's how medication also affects our breathing as a problem. So that's just what I wanted to contribute to
Thank
what
you so
Mr.
much.
Godwin
I like the
asked
dimension.
earlier. Thank
I
you,
like
sir.
the dimension you brought in, and that dimension speaks to medication safety mostly. Let me throw this here. When I used to live in Port Harcourt many years ago, and when I was moving to Lagos, 2006, I was coming to Lagos to set up a television program called Health Reporting Network, and this was supposed to be a program that would be designed that would focus on medical education, health education, and that was what it was all about. But when I came, I started doing interviews. I have a lot of clips I wanted to use to start the program. I didn't have sponsorship. That's why that program never came, because the cost that I was getting from television stations was about $500,000 per week. I mean, even if they sell me, I don't have that kind of money. I didn't have that kind of money at that time. But one thing I remember clearly is that I was looking for the late Dora Akuyele then. It was still alive then. That was about the time that Yaradua was contesting for election. Dora Akuyele was alive, so I kept going to his office to drop a note. I want to see him. So I couldn't see him because he was following President Yaradua for his campaigns because he was not available. So one day I now finally caught her in her office. He told me, I said, I want to interview you on the issue of Novocaine and Anagin that you banned and why the ban became necessary. And she told me, I thought we had finished with this issue. I said, no. So, and I said, what the drugs are still in the country because people don't know why those medications are valuable. But I believe if we are able to create awareness and education for people that use them and they know what the risk inherent in these drugs are, you don't need to talk too much. The drug will die natural death. How will it die natural death? The people who are smuggling it in will smuggle them in. And once there are no buyers to sustain those drugs that they smuggle in, the drugs will die natural. They said he didn't know. He said, I didn't know. Please come to my house on Tuesday morning, 7 a.m. We'll do this interview. I went to her house that morning to do the interview. But the point I want to draw out is when I interviewed her for an hour, 30 minutes, one thing that was so remarkable in her interview is he said, I do not even take medications, yet I'm the DG of NAFDAC. He said, every medication you take, it will do the work it was sent to do, but every medication is chemical. You do the work, but you leave some damages. He said, when I'm coming back, I'm having headache, I feel some nausea or sick feeling. He said, when I come back to my house, I drink a lot of water and I go to bed. It's only when that condition persists, when I wake up the next day, that I can now look for how I can take medication. He said Nigerians are too quick to live on medication. I think that's the point you were strengthening, Zeno, which of course is very correct. We must be careful on how we take in medication at every slightest opportunity. Most time you have fatigue. People have fatigue. Fatigue does not have drug. The only antidote to fatigue is rest. Most time we have fatigue. We come in, we swallow paracetamol, we swallow all this. It's not going to help you. The only antidote that fatigue can ever have that it responds to is how can I have rest? If you take your time, sleep, and avoid things that stress you, you find out that the next day you feel better. with or without the medication. So I appreciate that fact you brought in. You strengthened the we must be careful on what we're taking and how often we take drugs into our body, because the medications will do what you send them to do, but the medications are chemicals. Don't forget, they also destroy part of our bodies. Thank you so much. Any other question?
Thank you, sir.
You're welcome. Are there further questions?
Good evening, sir.
Good evening, Kenneth. How are you?
Fine. Please, I want you to throw more light on cardiac arrest and this thing, heart attack. What's the difference between the two?
The same thing. It's one and same thing, because it's when, like I said earlier on, when the oxygen or blood that needs to go to your heart are not able to pass through fluently and freely, or even they are blocked. That's why I use those three arteries. I told you how the three arteries look like. When the arteries is open, it's still fresh. The passages are not blocked with any opaque, and blood and oxygen is able to go in and out. I mean, that's a functional artery. But when the arteries become blocked because of the fatty food that we eat, because of the food high in cholesterol, they leave opaque. They get the thing opaque and leave a lot of things blocked, and there's no free flow. There's no free movement of oxygen and the blood into our heart. What that happens is that the heart does not have enough oxygen it needs to function, and the heart does not have enough blood it needs to function. The next thing is just like when you have your engine, when you have your car engine running without oil. That's what I can use. When you have your car engine running without, what happens? It will knock, isn't it? The same thing that happens to heart. Heart attack or cardiac arrest is knocking of the heart. Like I said earlier on, the heart is like the engine. It's like the engine of our body. When it doesn't have enough oil coming in, or enough oxygen coming in, enough blood coming in, next thing it will malfunction. That's where you have congestion and you have heart attack or cardiac arrest. Okay.
Okay, thank you.
Thank you, Kenneth. Any other question? Questions?
Yeah, I guess you did a very good job. That's why nobody asked more questions than that. They are basically pedestal questions that you've dealt with already. So I definitely commend you, for taking your time to break it down and explain. Every other question I think you've dealt with, and it seems to be going around the same thing. Thank you for the extra light you shared, even in your interview with the late Dora Kunyele. I was privileged to also speak with her on things like that, and I can bear you witness that's our position on those kind of issues. Thank you for doing a good job.
Thank you, my brother.
Keep doing more. I appreciate you plenty.
Thank you so much. Okay, if there are no further questions,
Can I come in, please?
Why not?
Okay. Just something that was just boggling my mind. When you talk about emergency response, and we know for sure that when it comes to administering CPR, you have to continue it until the person is resuscitated, or there's an external help, maybe an ambulance. In the Nigerian context, where we know that our emergency system is not that functional like we have in the Western world.
No, please, sorry, Gloria, please mute your mic, because I can't hear this guy properly. I want to hear what he's saying. Godwin, go on.
Okay, so I just want to know your own opinion or your advice. the emergency
On
system
what?
in Nigeria, in our country, not as we have in the Western world. However, when
Yeah.
somebody is performing a CPR with the hope that there will be another help to nearby or an ambulance coming around, which we know our emergency numbers sometimes are not functional. And the person cannot leave the patient in that condition, continue to perform the CPR. What would you advise?
A very good question, because the truth is that
I don't know if you get my question.
I got you. We live in a very delicate and sometimes seemingly frustrating environment where you know what to do, but you are not able to do it for obvious reasons. The truth is that as a matter of fact, in Nigeria, we don't have an emergency system. We don't. Whatever we think we have, we are just only joking. Even as much as NEMA, we are joking. I'll share a story with you. I used to work for critical rescue many years ago, and 2010, we're supposed to go to South Africa for a meeting. And while we're preparing for that meeting, the emergency ER24 were our partners we're going to have this meeting with. They send us a message that this meeting may not hold again because Spain had a natural disaster. So I was wondering, how come Spain is so close to South Africa? How will South Africa? How will the disaster that happened in Spain become an issue that will stop our meeting in South Africa? They gave us 2 weeks after to come. We went, but I had this question I had to ask them. When I got to South Africa, the first question I asked was, why did Spain natural disaster became an impediment to the meeting we're supposed to have with you guys in South Africa? You guys are not close. You know what I found out from that conversation? There's what you call alliance of countries on emergency response. They told me that there's that alliance of countries that support themselves on emergency response. When you have natural disasters, all the countries will pull resources together. They will all come to you and help you out till you get out of that mess. So Spain had a disaster. Spain is a part of those countries. South Africa had to go, send people there with aircraft, with response team. They had to be in Spain until Spain overcame that issue. And I said, really? So yes, and I asked them, is Nigeria part of these alliances? They told me no. I shook my head. So what am I saying? We are lucky that we don't have disasters like other countries. And perhaps that's why we don't know what emergency really means. When we talk about emergency in Nigeria, we are only joking because we have not even started. Many years ago, I had a meeting with some guys that came from Philip Healthcare in Nigeria. And one of the managers that came from Holland told me, I was passing, I saw an ambulance with an Lagos State ambulance, Lagos Lasan bus, but an intensive care ambulance. I would have loved to stop to see that ambulance, what they have in here. I told him, don't worry yourself. It's a bus. They forget about what we expect to see as an intensive care ambulance and you will see abroad. It's just a name. We are quick to do that. But the truth is that emergency is not what is treated with lip service. South Africa is a clear example. They have what you call the South Africa Accident and Emergency Trust Fund. What happens with that fund is that every month, maybe about 2% or less than 1% of each worker's salary is drawn from source. And the government bring about 3% and add to that money. That becomes the emergency trust fund of that country. When there's an emergency, that's what they use to respond. That's why you have ambulances, you have everything, call centers. South Africa is the most emergency prepared country in the whole of Africa. That's why they have the highest level of paramedics in South Africa. What paramedics in South Africa will do, it will amaze you. But we have people that we have ambulances here that are not even equipped. Even the people that are in the ambulances, you ask them, what your credentials? How are you credentialed? What are your qualifications? They said, oh, I finished from one health School of Health and Science at maybe Ubomosho or somewhere in the Enugu or somewhere in Abeokuta. I was giving job here. That you finish on the School of Health and Science doesn't make you a responder. You can be a doctor. That doesn't make you a responder. A responder is trained differently to be able to manage emergencies. That's why when the responder sees an emergency, another person sees an emergency, they don't see it from the same perspective. As a matter of fact, when I go to South Africa, what I do is I still go to work in an ambulance. I just want to just sharpen my skills. I tell them I'm around. I want to work in an ambulance for 2 nights because I have partnership with ER24. I want to work in an ambulance for at least two times before I leave. They ask me day or night. I tell them night. What time? 7 p.m. is fine by me. So they drive to my hotel, they pick me and assign me to an ambulance. So I work with them all through the night. Sometimes they bring back to my hotel about 4:30 in the morning. Why do I do that? I like what I see. I like to learn. I like to refresh my skills. I like to see what they are doing differently. And this interests me greatly. I tell you the truth, call an ambulance in Nigeria at about 1 a.m. They won't come. They say when Fashola was a governor then, there was a case I brought to his table. Oh, I wrote him an email, he responded to me because one man was complaining that if Lasambos had come my way early, my child wouldn't have died. It was carried by Punch newspaper. How can you have an ambulance and you use and the ambulance to respond? You can't get the benefit you get from the guy called an ambulance at about 12:30 a.m. The ambulance didn't come to him. This child was sick until he was able to having crisis until he was able to stay with that child till about 5:30 a.m. in the morning when buses were already on the road. Use bus to bring the child to Lasut. The child died. So these are the issues. Either we have ambulances or we do not have. Don't paint vehicle and write an ambulance on them and give a false impression that we have an ambulance. And when the chiefs are down, the ambulance cannot do anything. We need to really restructure our emergency management system or emergency response system. We don't just want to see doctors in the ambulance. Doctors are trained on curative medicine. We want to see people that are trained paramedics man the ambulance, licensed, certified. And this is what we advocate for. Thank you so much, Godwin, for bringing this up. Any further question, contribution, or comments? Okay. If there is no further comment or contribution, I want to thank you so much for the very great class. Okay, Zeno, your hand is up.
Okay, sir. Regarding the question Mr. Godwin just asked, I believe what he asked was due to our country's beautiful medical situation. How does one survive carrying out a CPRO for a longer time, awaiting help from the specified or necessary body? So basically, I believe in that situation.
Okay, what you would do at that time, because you're already dead. That's why you see, I mean, most times people end up in the hospital with private vehicles, not with ambulances. You just look for how people can help you, and that's when you're calling from those help. When you're calling from those help, you are doing compression. Can somebody make a vehicle available for me? I need to take them to the hospital as quickly as possible. And most people will won't drive past you; they won't stop. But you'll be lucky, you know. Some good Samaritan stops and able to say, let's help this person. And able to, I mean, you're able to put the person into a vehicle, but understand also that you are squeezing this person into the back of his seat. Unlike how it would be if the person was stretched into an ambulance, where the person can lay down, yes, and you are able to do your work till you get to the hospital. So these are the differences. These are the differences. Okay. So most times, these kind of people that you squeeze into the seat back of the vehicle, sometimes you take to the hospital, they say dead on arrival. So any other questions? So if there is none, I think time is fast. It is past 9. So let me on this note say thank you once again, and We look forward to having further classes like this just to share ideas. No one is a professional here. We all learn from each other. And the questions that came up also, we also to strengthen our learning processes. And thank you so much, and have a good sleep and have a restful night. God bless you all, and good night.
Good night. God bless you.
Good night. God
Good
bless
night,
you. Thank
sir.
you.
Thank you.
Good night.
Good night. Good night, everyone.
Good night, sir. God
Good night.
bless you.
Yeah.
Good night,
Good night.
Oyakilome.
Hey, my personal person, sir. Hallelujah forever.
Good that you are here.
Yeah,
Good
good
night,
night.
sir. Thank you very much.
Yes, sir. Well done, sir. Well done, sir. Thank you, sir.
How are
Yes,
you?
sir. And yes,
Thank you very much, sir. Good night, sir.
Thank you so much. Thank you so much.
Thank you very much, sir. Good night.
All right. Good night.
Wickedness. Somebody dey do good, make it turn to bad again.
Say make I go help you. I said no, I don't go help you. I don't forget say Danny
Good
dog.
night. Good night. Dr. Rico.
Oh, who is there?
Good night.
That's Reverend Dr. Young Chris. Okay, now.
Yes.
Good to hear your voice.
Bless you.
I tell cook say cook. I know Jimmy make I follow you, make I follow you, make I follow you. After I follow up, I can't go because this is my first time. Yeah, now if I even at the year the Oga voice, now I just quickly follow wait till I open the door we are fast.